Hello, my name is Kenneth Fung. I'm a psychiatrist from Toronto, Canada. It's my pleasure to be able to share with you a little bit about my thoughts on ACT, or Acceptance and Commitment Therapy, and spirituality. Now I would like to share with you about the core ACT model. Here you can see in the center, psychological inflexibility. So from an ACT perspective, we formulate challenges of human suffering, not specific according to disorders. Instead, it targets transdiagnostic human processes. And in this case, the core of a lot of our suffering comes from psychological inflexibility. And these are some of the psychological inflexible processes and how ACT attempts to help patients and clients learn these ACT processes or ACT skills. If we come to the lower left-hand corner, we see cognitive fusion. This is to say that we are often stuck with having certain thoughts. Fusion is a sense of stickiness. Things are glued together. So in this case, we are glued to our thoughts, and it appears to be that we perceive thoughts as being glued to reality, so that we experience ourselves as being stuck in our real lives. So instead, ACT trains us to have the skill of cognitive diffusion. That's to separate out all these components. We are able to observe our thoughts as thoughts. And so instead of changing our particular thoughts or feelings, it aims to change our relationship with thoughts so that we see thoughts as only thoughts, and thoughts is also separated out from reality. So that's cognitive diffusion. Instead of everything fused together and stuck together, we are separated from our thoughts. We can observe our thoughts, and that we see that thoughts is actually separate from reality. And so we relate to our thoughts as merely thoughts. On the upper left-hand corner is experiential avoidance. That's to say that we are only human beings. We have a tendency to turn away, to control, to try to change, and try to overcome negative thoughts and feelings. So this attempt to control or to avoid, it's a form of experiential avoidance. In ACT, we cultivate a sense of acceptance, hence the name ACT, Acceptance Commitment Therapy. Here we see acceptance as a very active thing to do. It is actually the willingness to experience thoughts and feelings as they are, whether they are positive or negative, whether it's the truth or it's not the truth. We're able to be willing to experience thoughts and feelings rather than to try to control them, to try to struggle with them, or try to change them, or try to avoid from them, right? So acceptance and diffusion together, when we embrace these ACT processes, we become more open. On the top, you see the dominance of conceptualized past and the future, and that's to say that quite often we feel trapped by what happened in the past. It could be trauma, it could be things that we've regretted doing, things that have occurred to us that cannot be changed. Also, we might be very worried about the future. Rather than being caught up by the past or the future, ACT encourages us to stay in the contact with the present moment. It's not only distant past or distant future, but even sometimes we get distracted about thinking about what happened yesterday or what's going to happen tonight. All of that distracts us from the present moment. We are often in autopilot mode, very distracted from the present. And so there's a healing component to staying in contact with the present moment. On the bottom is attachment to conceptualized self. We have many ideas about who we are. It can be our profession, it can be our roles, it can be our personality, it can be the stories and narratives about us. While they may serve certain purposes and function, sometimes we can become overly attached to them. And this can cause a number of problems. For example, when there needs to be a change, we might feel that we are constricted by our ideas about ourselves, and it's hard to make progressive changes. If you really, really believe that you're a shy person, you might avoid socializing, for example. So this belief in conceptualized self can, in some ways, constrict us from changing and causing kind of self-fulfilling prophecy. The other thing is, again, this idea of change. If you were overly attached to your job, let's say, and then you lose your job, some people experience this as a loss of sense of self. So rather than identifying ourselves so much with our roles, our jobs, or our relationships, we have this concept of self as context in act. Another name for this is also a transcendent sense of self, or an observer self. That's to say, self as context is to distinguish this from self as content. The concepts about ourselves are self as content, but context is the background, the psychological context in which psychological contents unfold. So to be in touch with the observer self, or the transcendent sense of self, or self as context, is to see that we don't need to be defined by our narratives or our labels, or our stories about ourselves. We are the self as context, the observer self, that's always flexible and capable of change. There's a core part of us that's transcendent and resilient across moments in time. On the upper right hand corner is a lack of values clarity, or the dominance of unworkable rule-governed behaviors. Sometimes we act in a certain way just because we're used to acting in a certain way, or we're not quite sure about why we are acting in such a way. Maybe society expects this of us. Maybe there are certain rules that we are unconsciously following. In ACT, it cultivates a sense of values so that we can, through a values clarification process, become clear about what matters to us, what our life stands for. These are our values. And values are different from goals. Instead of something that you can achieve or fail to achieve, instead it's a general sense of direction, what makes life meaningful. And if one goal doesn't work, if we know our values, we can flexibly change a goal. So knowing our values gives us a sense of direction regardless of where and when we are. On the lower right hand corner, it's looking at our actions. Sometimes we say we believe in something, but there's inaction, or sometimes we impulsively do things just because we're reacting based on our emotions, and other times we avoid things altogether. We avoid doing certain things. Instead of having these kinds of action patterns, ACT helps us increase our committed action. That's to say, patterns of action behavior which is in commitment and in alignment with our values, what we care about, and we stay committed to it. If we act on these core ACT processes, you can see that they're all interconnected, and what we're doing is, if you look at the center, we're increasing our psychological flexibility. If we work on one, naturally another will increase. Now, I will also explain this through a set of hand gestures so that you can also experience what it's like. If you put your hands together, and in fact, if you give it a little push, this is a sense of stuckness that we sometimes feel, stuck with our thoughts and stuck with our feelings. And we can first diffuse, which is introduce a little space between yourselves and your thoughts and feelings. We can come to observe them, right? Just a little space without needing to change your thoughts and feelings. In fact, we can pivot and open up. In the action of pivoting and open up, we're cultivating acceptance. We come to the present moment. That's to say, not to the past and not to the distant future. We come to the center, right here, right now. This is the only reality in this moment, and there's healing in this moment, right? And then if we do a fist and a cup, we ask ourselves, are we the kind of cup or are we the fist? In fact, we are the cup, not the fist, right? Imagine that you are a coffee cup. So you're not defined by yesterday's old coffee, the trauma, and the stories, but we are ready for a fresh cup of coffee today. We are the self as context, self as a container, the observer self, and we are ready to write a new chapter in our lives, flexible to change, as the self as context. And then if we really cup our hands, imagine you're in the desert, and I put water in your hands. You probably don't want to let a single drop of water slip through your fingers. That's your values. So you ask yourself, what do you want to make sure you don't want to let it slip through your life? Those are your values, things we really care about. And now, knowing our values, we can do Pinky Swear, which is a sense of committed action. How can we commit to these values and turn them into action, however small? ACT is also known as a mindfulness-based psychotherapy. And there are various ways of defining mindfulness, but one way is looking at different components of mindfulness that John Kabat-Zinn and company has promoted, such as being in the present moment, right here, right now, paying attention, becoming aware in a non-judgmental acceptance kind of stance. It might be helpful to know that ACT comes from relational frame theory. There's a theory in which it's based on, and that theory itself is based on a philosophy of functional contextualism or radical behavioralism. And I think it would be helpful to trace the cultural and spiritual origins of ACT if we want to talk about the spiritual dimensions of ACT. Stephen Hayes, one of the inventors, fathers of ACT, based a lot of ACT on the work of Skinner, behavioralism, father behavioralism, which philosophically is based on American pragmatism, William James and John Dewey. And in fact, if we trace back further, they have been highly influenced by Zen Buddhism, D.T. Suzuki and Shunryu Suzuki. And in fact, this, of course, then comes from the classical traditional Buddhism in origins. And the reason I think it's helpful, even though sometimes people avoid it, to talk about the spiritual and cultural origins of some of these ideas is that I feel that we can get deeper insights into ACT, and if we are able to know about the origins. So for example, from the tradition of Zen Buddhism, if we look at Master Thich Nhat Hanh and some of these quotes, it helps us understand when we mindfully meditate, it's not simply a technology to feel calm. And in fact, if you use it like that, quite often it has the opposite effect. But if we do mindfulness in a deep way, actually we're able to see our interconnectedness. And that is to say, to letting go of the self in a deeper way. That's not to say that this is the only way to conceptualize mindfulness, but it's an example of how we can be enriched if we know about the cultural and spiritual origins of ACT. In fact, if we don't pay attention to spiritual and cultural origins of ACT, we can be inadvertently perpetrating harm. And just this slide shows a variety of ways in which we might be perpetuating systemic racism. We might be culturally appropriating a practice. We might not be truly thinking about the mindfulness in its true spirit as meant in Buddhism, and also perhaps misusing mindfulness, such as when we train soldiers, are we really only increasing their well-being? What about increasing their ability to kill, which which is the opposite of what Buddhism stands for in terms of nonviolence. Act and mindfulness has its origin in Buddhism. I have the experience and privilege of running act groups along with a Buddhist monk. This is just one example how act can be delivered in combination, in collaboration with spiritual and religious tradition. This is not to say then that act can be only used with the religious tradition of Buddhism. Certainly, I've worked with indigenous elders for the indigenous community where they are contextualizing act according to indigenous traditions. Here, I'm giving you another example, and if you're up for it, this is a thesis by Chris, and he is looking at contemplative reasoning in his thesis, and together we have delivered act for the Christian community. And examples such as the Ignatian Gospel contemplation and the Lectio Divina contemplation are just examples of how mindfulness-like contemplation can be delivered in a Christian context. To take a bird's eye view, perhaps more pragmatically, these are some suggestions I would recommend as we experience and try to incorporate spirituality with act. Perhaps we can be thinking and reflecting in our delivery of care, investigating, exploring with the patient, what do they need to let go of? Sometimes it's about rigid rules that we've inherited. Sometimes it's about our ego. Sometimes it's about judgments and other kinds of evaluations, what's right, what's wrong. That might be very rigid and not workable. We may need to let go of. Second, there might be something healing in the present moment. And so that's not only to say to avoid from the past trauma, we're bringing the past trauma into the light of the present moment. And more importantly, the present moment often includes you as the healthcare provider. So how do you have that present moment healing space when you are engaging with your patient or client in this present moment? I find that also very healing and very spiritual. And the idea of letting go of the self, we can start to explore a transcendent sense of self that's not defined by the mundane, or to explore deeper our interconnectedness, whether it is in our interconnectedness and relationship and communion with the higher power in certain religious tradition, like the divine, or if you're humanistic, with nature, or with everyone and everything in the universe, if you're from a Buddhist tradition, for example. So this idea of a transcendent sense of self, I think act lends itself to this kind of exploration. And finally, the very explicit exploration of values and the meaning of this life as a way of helping us ask existential and spiritual related questions. What is the meaning of life, and what makes this life worthwhile? And what is the meaning of everything we do, even small things we do, moment by moment? And how can we become more effective in our values and have actions that are consistent with our values? So I think that this is my time. I want to thank you for your attention, and I look forward to discussion. Thank you.